Um, Good afternoon, esteemed professor and colleagues. My name is Linh. I'm a doctor in 103 hospital. Today, I'm very happy when I stay here in order to present our topic. Our topic is value of diffusion weight imaging in the detection of seminal vesicle invasion in prostate cancer. Our topic has 5 parts. The first, introduction. As you know, prostate cancer is very common in contemporary life. As you can see from the picture, prostate shown in green with a wide contribution across all continents. This demonstrates that prostate cancer is not only a global health problem, but also a growing concern in other regions. According to Global 2002, prostate cancer is the second most common malignancy in men. It ranks among the top 10 cancers with the highest mortality rate. This picture illustrates the state of prostate cancer according to TNM system. You can see seminal vesicle invasion corresponds to stage 3B. Detecting seminal vesicle invasion is essential because it accelerates state disease and directly impacts on treatment planning and prognosis. Multiparametric magnetic resonance imaging have proven to be an effective imaging modality in evaluating seminal vesicle invasion, in which diffusion weight imaging is one of the most frequent, especially combined with the T2 to enhance diagnostic accuracy. While several international studies have explored to the role of the diffusion weight imaging in assessing seminal vesicle invasion, there is still lack of such study in Vietnam. Therefore, we conducted this study to detecting seminal vesicle invasion in prostate cancer. Through material and methods, we studied 56 prostate cancer patients who were examined at CAR 3 hospital from January to December 2024. Inclusion criteria, patients were eligible if they have confirmed a diagnosis of prostate cancer via biopsy or post-operative histopathology, undergone prostate MRI with full sequences before any intervention or treatment. On patient has histopathological confirmation of seminal vesicle status. Exclusion criteria, we exclude patients who did not undergo prostate MRI prior to intervention or treatment, cases without available histopathology of seminal vesicle, poor quality image, and incomplete research record. Methods, we perform a retrospective cross-section study. Research instrument includes 1.5 Tesla MRI system, ADC processing software, medical record, data collection form. Data was underlined by SPSS version 20. This is protocol MRI prostate cancer. Here we saw rod placement. Sufficient location area was chosen where T2 site was low and restricted diffusion. Rod should be placed avoiding necrotic, calcified, or hemorrhagic lesion. The rod size range from 20 to 40 square millimeter. Results and discussion. This slide shows the general characteristic of study population. We study 56 patients with a mean age of 68 years. The PSA, the average PSA level in the seminal vesicle invasion was higher than the non-seminal vesicle invasion. These results align with their Zoom. Values of MRI in evaluating seminal vesicle invasion on qualitative sequence. You can see from the bar chart, combining T2 with diffusion weight imaging improved diagnostic performance. With T2 alone, the accuracy was about 82%. With diffusion weighted imaging alone, the sensitivities were higher and the accuracy reached 86%. When combining T2 with diffusion weight imaging, the results were balanced and the accuracy remained 86%. quantitative evaluation, the minimum ADC in the seminal vertical invasion group was 0.601 times 10 to the minus 3 square millimeter per second, significantly lower than that in the non-seminal vertical invasion. The box plots illustrate the minimum ADC in the seminal vertical invasion group are consistently lower than that in prostate cancer lesion and normal seminal tissue. From the raw curve, the optimal minimum ADC value for distinguishing between invasive and non-invasive lesion was 0.835 times 10 to minus 3 square millimeter per second, with sensitivities about 90% and negative predictive values about 94%. This demonstrates that the minimum ADC value is one of the powerful tools in predicting seminal vertical invasion. When we combine T2 with quantification, diffusion weighted imaging in detecting seminal vertical invasion with histopathology, we found that this method has the highest specificities and accuracy with 81% and 89% respectively. In conclusion, diffusion weighted imaging has high value in assessing seminal vertical invasion in patients with prostate cancer. When combined with the T2 and diffusion weighted imaging, yield better diagnostic performance compare single sequence evaluation. The ADC quantification strengthen diagnostic reliabilities and should be considered in clinical decision making. Our topic has some limitation with short duration, small sample size, using pelvic coil instead of endorectal coil imaging. Histopathological results include cases obtained from transrectal ultrasound guide biopsy as well as surgical specimen, which may have affected the accuracy of the finding. With K report, this is a 71-year-old male with PSA level 1,018 nanogram per milliliter and right bilateral lesion, assessing DRAT5 and including a classical feature of seminal vertical invasion. The minimum ADC in the seminal vertical side about 0.646 times 10 to minus 3 square millimeter per second, which was lower than that in the tumor side. Histopathology confirmed carcinoma with a Gleason score 9 score and a bilateral seminal vertical invasion. Thanks for your attention.